Hello everyone, welcome to my channel. My name is Joel, and today I want to tell you about a fairly common disease. A lot of people are having it, but they don't actually know about the details of it, which is hypertension. Hypertension is what normal people know as high blood pressure. Our blood pressure is high. But in order to tell that your blood pressure is really higher, there must be a cutoff point, right? There must be a number to determine your blood pressure is high. That number is 140/90, which means your systolic blood pressure is 140 and your diastolic pressure is 90. Blood pressure must be taken at least 3 times, separated by 2 hours in between. We all know hypertension can be caused by salty diet, obesity, all these lifestyle factors, right? But actually all these lifestyle factors are grouped as primary hypertension. Primary means there's no actually a disease causing the hypertension. You only have risk factors, which are the things that increase your chances of getting a hypertension, but not actually causing it. So for primary hypertension, the cause is unknown. But those risk factors, other than lifestyle factors, there are also other causes of primary hypertension. Genetic, or some people are born with higher levels of angiotensin II hormone in their body. Or some people have better beta adrenergic response in their body. Primary hypertension is actually the most common type of hypertension. It accounts for 95% of all hypertension. Only 5% of the hypertension is secondary in causes. Well, for this secondary cause, we usually suspect young hypertension, which means the patient is below 40 years old. The most common cause of secondary hypertension is actually renal damage, the disease of our kidney. When our kidney is damaged, it cannot excrete the salt or the sodium from the body. So the salt actually accumulates in the body and it causes water retention. Some kidney disease are like glomerulonephritis, autosomal dominant polycystic kidney disease, pyelonephrosis, or kidney stones. Next, secondary hypertension can also be caused by endocrine causes, which means our hormones. As we know, our body has a few glands that secrete hormones, such as our pituitary gland. One of the hormones that it secretes is ACTH hormone, adrenocorticotrophic hormones. It may cause Cushing syndrome. Next, thyroid. If our thyroid secretes too much of T3 hormones or too less of T3 hormones in our body, it causes hyper or hypothyroidism. Both can cause hypertension. Next, adrenal glands, just above our kidney. They secrete aldosterone. Aldosterone is a hormone that causes salt retention in the body. It also secretes cortisol. Cortisol is a hormone that promotes sugar retention in the body. It also secretes adrenaline and noradrenaline. These two hormones increases the metabolic rate of our body. So all these hormones, if produced in excess, will cause hypertension. Sometimes hypertension can also be caused by something more serious, such as increased intracranial pressure. This increase in pressure can either be caused by a brain infarct, such as stroke, or an intracranial hemorrhage or intracranial bleed, which increase the volume in our skull. Or it can be caused by something more common, such as atherosclerosis, which is the narrowing of the blood vessels, which can be caused by diabetes. Sometimes it can be caused by something more temporary, such as of stress. Actually, a lot of people have hypertension without them knowing it because it's causing no symptoms at all. It's not affecting their daily lives. So they don't bother going to the doctor. They will only go to a doctor when hypertension gets serious, right? When there are symptoms, when there are complications. So some of the symptoms that they can usually feel is headache, nausea, vomiting, or giddiness, sometimes seizure. Sometimes hypertension affects their eyes, they have blurry vision, or reduced visual acuity, or sometimes even blindness. It can also cause chest pain, or sometimes the renal disease, such as hematuria, blood in your urine, or oliguria, less urine secreted. So let's say for example you go to a doctor with chest pain. The first thing the doctor will think about is you have a heart attack, or you have an infection, or you have a pulmonary embolism. So first they will ask questions on you, history taking, on those main differentials they have. But they will also include hypertension in their history. For example, they will ask you, do you have hypertension before? And if you say yes, they will ask further about that history, like when did you have your hypertension? How often do you follow up at the clinic? Do you forget your appointment at the clinic? Do you take your drugs? Then the doctor will check whether you have hypertension or not by measuring your blood pressure. So based on the result of your blood pressure reading, they will decide what to do on you. If your blood pressure is less than 140 or 90, but you have the presence of risk factors for cardiovascular disease, or you have clear signs of damage to your organ, or your reading is higher than 140 or 90, then the doctor will use a machine called ambulatory blood pressure monitoring, which is basically a cuff attached to your arm for a 24-hour period to take the blood pressure readings maybe once per hour or once per half an hour. They take a series of readings because remember, hypertension cannot be taken by one reading alone. However, it is very important to know that every person has a different prognosis, meaning different outcomes if they have the same blood pressure. Let's say A, blood pressure 150, 90, B, blood pressure 150, 90. But A will have a heart attack, but B will not. So what is making the difference? The difference is A has risk factors for heart attack or cardiovascular disease. B doesn't have. Or A has end organ damage, which means his heart is already damaged before the onset of hypertension. So hypertension actually accelerates the damage to his heart. Or A has other concomitant disease such as diabetes, cardiovascular disease. So when hypertension comes, it combines with those other risk factors to cause damage to his organs. So how do we know if the patient has risk factors or end organ damage? History taking. How old are you, sir? If he says, I'm 56 years old, which means he's larger than 55 years old. So that is the risk factors. Do your family members have heart attack or heart disease? If he says yes, that is a risk factor. During physical examination, if the patient's apex beat is deviated or displaced left ventricular hypertrophy, that is a sign of end organ damage. So if the patient has no risk factors or end organ damage, and the blood pressure is below 140 and 90, maybe he just needs a lifestyle modification. Maybe he just needs to control his diet, do more exercise. But if there are risk factors or end organ damage present, then we will need to consider if he needs antihypertensive drug or just lifestyle modification alone? These kind of things comes into consideration. So, there is one type of hypertension that I haven't talked about just now, but we definitely shouldn't miss that one. It's called hypertensive crisis. It's when our blood pressure is larger than 180 and 120, and with presence of end organ damage. In this case, the patient is usually very ill, or he's even unconscious. But the first thing doctor will do is stabilize the patient. They'll give the patient oxygen support, IV line, and close monitoring of ECG, and other things. The second thing the doctors will do is immediate BP reduction. But remember, we cannot lower the blood pressure too fast. If the blood pressure is lowered immediately, it may cause insufficient blood to the heart and it may cause organ damage. It may cause infarct. So before we end our video here, I want to talk about the antihypertensive drugs that we commonly use. ACE inhibitor, beta blocker, calcium channel blockers, and diuretics. The types of drugs that doctor give is actually based on your disease. It's based on the indication of drug, because every drug works differently. ACE inhibitor, for example, if you have heart attack, acute coronary syndrome, myocardial infarction, then doctors will give beta blockers, because beta blockers causes vasodilation. In heart attack, usually the blood vessels are narrowed, so if we need to dilate it, so we give beta blockers. If you have diabetes and it causes kidney damage, then we give ACE inhibitors, because ACE actually is produced by the kidney. So we know ACE is high, so we give ACE inhibitor. It will be most effective at treating diabetic nephropathy. If the patient have heart failure, and you know it's causing pitting edema in his leg, you know he has fluid overload in his body, then we give diuretic. It makes the patient pee more. So it actually carries all the sodium in the body and excrete out. But if the patient somehow has some contraindications, the drug doesn't fit the patient, then we give the second line drug. It can either be beta blocker, angiotensin II receptor blocker, and other drugs. Make sure you don't give wrong drug to patient. For example, we should not give calcium channel blocker to a heart failure patient, because calcium channel blocker reduces the contractility of the heart. In heart failure patient, the heart is already very slowly pumping. If you slow it down even more by calcium channel blocker, it will only deteriorate the patient's conditions. So, that's about everything that I want to tell you today. The information that I covered in this video is maybe just less than 10% of all the information about hypertension. If you wish to learn more about it, you can read about it, you can research about it yourself. And I want to tell you that the information that I presented to you today is all from Priscilla Medicine Volume 1 and Oxford Handbook of Clinical Medicine. These two books are two of the most respectable books for clinical students and also medical doctors. If you find I missed any information that I should cover but I didn't, you can edit in the comment section below, or you think I say something wrong, something inaccurate, you can help correct me by also comment in the comment section. But anyway, I really hope you think what I tell you is relevant and my presentation is suitable for you, and I really hope that you enjoy the video. And with that, I'll see you in the next video. Bye.